because you guys have like this little jazz thing in front, right? But that I'm guessing Dylan just adds it after.
Hello.
Howdy.
Howdy. All right. So, welcome back to the Well Society podcast. And thanks for tuning in. And we've got a lot of feedback and responses for all the to the previous episode. And
Yep.
Duma? Yep.
Yeah, we got heaps of beautiful feedback, criticism, which is good. Send them through. We got a lot of voice memos as well from people who had their own stories about the tsunami, which is awesome. So send them through. We might actually put those out later as well. I think one of the main things people were telling us was we kind of tend to repeat ourselves a lot, going in circles, because we forget it's a podcast and we're just mates talking, so kind of go in loops sometimes. So we'll be a bit more aware of that this time. But yeah, thanks for listening to the previous episode.
Yeah. So, agree with that 100%. We'll try to be more aware of us. I'm literally repeating what he said. So yeah.
Already.
All right. So episode 2. We've got an old friend of ours.
Yeah, we go way back.
Yeah, even though she doesn't remember.
I beg to differ. We've been friends for like 10 years now, right? Friends is questionable.
Probably.
Definitely.
Friends is
Acquaintances.
You hated me for so long as well.
I didn't know you existed till I forgot about you from like 6th
you
to like maybe 10th
and
grade.
Then like you forgot and then reconnected.
Just blame it on puberty. I don't know. Okay, let's move on. Yeah.
Yeah, if you want to go into all of that detail.
Yeah, especially with Dylan. There's a lot of history there.
Okay.
Okay. So we got Vinuri.
Hi.
Hello.
Thanks for having me.
Yeah, all good. Thanks for being here. We know you as a friend from school, but most of our listeners probably don't know you. Some will. Would you like to give a small introduction about yourself?
Yeah, so I'm currently a medical intern. I'm from Sri Lanka originally, obviously, but I did my degree in China. And right now, because of travel restrictions, I'm sort of stuck outside and on a period of deferral, during which I've sort of been in and out of the Sri Lankan healthcare system. So I have a bit of experience there as well. But yeah, and other than that, more importantly, I think we've known each other for about 10 years. That's the main reason why I'm here.
And because you got really good stories to tell us. That's crazy.
Apparently, according to you guys. Yeah, but like I'd like to say before that, like, for anyone involved in like the medical sector, even remotely, a lot of the things I say are probably very minute and it doesn't even sort of hit them. But for you guys, it's obviously probably not part of your day-to-day sort of lives. So maybe you guys find it interesting, but anyone who's from like the medical, sector just listening in, maybe it might not be as fascinating. Just saying that before we go in.
Yeah, fair enough. But all the medical students listening in, don't pause now. Just keep listening. Don't listen to.
Just leave in advance.
What are you doing?
Something before we get into the whole medical stories and the whole aspect of it. We know you listened to the first episode.
I did from last week, right?
Yeah.
Last Saturday. Yeah.
And that's something we would like to get into, about how some sort of the whole aspect about distress and trauma.
Yeah, because I feel like we've been throwing that trauma word around, too freely. I think when we had that little chat before we started recording, you brought up a really good point where, you know, for you it wasn't traumatic, it was a bit distressing, but it wasn't traumatic at all. And yeah, maybe we'd like to hear a bit about what you think about it in terms, I mean, with all your, you know, background.
Right. So like for me, I first say that, I can't speak for everyone else, obviously, not even you guys, even though after listening to last week's podcast, episode, it does sound like we went through the same stuff. But I feel like it depends on the person, right? On how they perceive certain things. So just because I didn't find it traumatic, I'm not, undermining what you guys went through or what your experience of it was. Because especially when you're in I think the clinical setting, you hear all these, you see all these really sad things. And I got especially during, I think, latter part of 2020, I got to meet quite a few patients who were ex-military. So when you hear people talk about things like that, I'm just generally really careful with what I label as traumatic. So it's just my 2 cents on that. It's obviously changes from person to person.
Yeah, no, you're right. And yeah, people can have different experiences. For me, I think I said it in the podcast as well, where it was only 12 years later when I went back and was doing a bit of research around it and just rewatching them. That's when it had a more profound effect on me. I don't know what that means. We're not I'm not a qualified, psychologist to know what that means, but we might bring in someone later who has a bit of knowledge around this to talk about it. But tell us a bit about what med school is, because I'm a computer science student. I go into lectures and I go to tutorials and I work on my computer. I come home, right? It's a bit different for you guys, I think. So, and I don't think most people know about that setup. Maybe kind of explain that a bit as well.
Oh, I don't think it's very different from, to be honest, if you look at some of the medical shows like House, or Grey's Anatomy, if you exclude all the drama, right? But if you just take the essence of what the show is about, I think it's somewhat similar. I'd say, less dramatized, but you get the gist of it. So you're not going to be completely mind blown if you were sort of thrown into a clinical setting. But I think it also, one thing I sort of realized is outside, if you take the lectures aside and just focus on the clinical part of things, I think it sort of numbs you to certain aspects of life, obviously, but it also almost amplifies certain elements. It's very difficult to sort of word it, some people find it more difficult, but I think even before med school, I've generally been less emotionally grounded as a person. But one thing I have noticed that, through med school is that weirdly, it has sort of, made me more aware of my emotions and, that side of things as a human, which is one of the things that I'm actually grateful for, because I think when I was in school, at least, I was very cynical as a person, and now I'm just overall more, I think, a bit jaded probably, but still, I think overall, or more grounded as a human. But if you were referring to what exactly do you mean, that experience? Is there a particular context that you're referring to, or?
No, I mean, that's, so just to go back to what you said, my initial reaction would be going to med school would, make you more sort of desensitized to the emotions of life, but it seems like it had the reverse effect on you, right? Which is,
in some aspects, yeah. When you think of let's say a surgery, I think that's one of the least traumatizing. I don't think there's any sort of negative emotions associated with that. At least for me personally, it was more like excitement, because you do the theory and then you learn about what's going to happen. So when you're thrown into that scene, you're just dying to know what how it really goes down. So even when you were sort of even when it came to forensics, it's when you have to autopsies and stuff. That's I think that's probably one of the more gruesome sides of med, because when it comes to surgeries, everything is so precise, right? They care about whoever they're cutting up. They're being so careful. Whereas when it comes to an autopsy, it's they don't really care. It's just they need to find the cause of death. But even then, I think the first time that I saw an autopsy, it was I was more into the specifics of what was going on, so that emotional, it doesn't really hit you. But that was probably because I had this graded exposure. I first saw photos and all of that, and I knew the theory of what went behind it. And then we saw a video of it. That sort of mentally, messed me up for like a few minutes maybe. And I was like, wow, that happens. But then when I saw it in real life, I was so prepared for it that it didn't really sort of, completely knock me out. But then obviously, like, some aspects are like really gruesome, and especially when they get to the face and all, and then they need to sort of peel back the skin and all that, that gets really, it sounds graphic when I say it, but yeah.
Yeah, you can see
But
my
like
face
that,
right
it's
now.
also interesting. Yeah, I'm just looking at it and I'm like, yeah. Yeah, but I remember like the first autopsy I went to, it was like a death by hanging. So I was like very fascinated. I was like, oh, this feels like,
Jesus.
like, and I see like the body, and then you can see the marks on the neck, the contusions, and it was very interesting, not gonna lie. But then after the first one, the sort of you get out of it dies down. I wouldn't say kick, but the what's the word for it? The novelty of it sort of dies down. I wouldn't even call it a thrill. It's novelty. Yeah. I think that's the correct word. Because like following that, most of the sort of opportunities I got, I like walked out like after the first 20 minutes, maybe. I was like, it's not worth it.
That makes sense, like what you said about, that graded exposure. I think with anything, it's the fear of like not knowing.
Yeah,
right?
definitely.
Like, that's what makes things like scary, because you don't know. And being inoculated slowly into something, right? That kind of takes away the fear, because you just know what's gonna come next, I guess.
Yeah, I mean, I feel like I would be able to get software engineering if I had like the graded exposure, right?
I mean, I've been trying for
if
10
you throw
years.
me in. I'm just saying, I feel like anything can be done if done slowly and steadily.
Agreed. What about China? How is China a bit different?
Firstly, the healthcare systems in China are like definitely more developed, right? So because I was like sort of fortunate enough to be in and out of the system here recently, I was able to sort of compare the differences. And I think the key difference is that patients have a lot more like autonomy over their bodies in China, because it's more of like a patient focused healthcare system. Firstly, because they're paying, right? The healthcare system isn't completely free. And secondly, because I think, because of that essentially, and also because maybe the doctor to patient ratio isn't as bad as Sri Lanka, I don't know. But there's a lot more attention placed on what the patient wants and what the options are. Whereas in Sri Lanka, it's just so many patients, right? I mean, I think the population of Australia and Sri Lanka are pretty much the same, even though we're like 1,000 times smaller than you guys geographically.
Yeah, you're right. Yeah. At least in 2015, it was almost similar. I think it's a bit more in Australia now, but I agree. Yeah, it's quite
so like in Sri
similar.
Lanka, the system is more like sort of physician focused, because the physician, like literally, he barely has any time to breathe. He just comes in and he sort of, says, do this, and like the patient's like, all right, but certain procedures, obviously, they need explanations, they need consent and all that. But it's more about just doing almost. But I think with the facilities and the resources that these physicians have, they do like a really great job, that I can say. I think because I'm still so early on, right, with regards to my career or whatever you want to call it, right, it's that I don't have a lot of exposure, but based on the little exposure that I do have, I think there've been maybe like 2 to 3 instances where things have sort of, just sort of stood still, and I've just sort of thought about it. I think the first one I already told Dumindu about, that was with regards to the cadaver, right? That we had with in anatomy, I think. Yeah, in anatomy. So like normally dissections start from your lower limbs upwards. So you normally keep the face covered, and then that's how you sort of go up, right? So like I was saying, because it's such a graded exposure, you're looking at, like, let's say if it's a lower limb dissection, you're looking at it so objectively. This is a lower limb, and you have to find these muscles, you need to trace these veins, these nerves, these arteries, right? And because we have like, external factors, like let's say exams sort of weighing in, right? You're so hyper focused on those things, you don't really worry about what you're doing. Like on the first day, like, we had to do like this little sort of ceremony, sure, but after that, other things sort of weigh in, and then you forget about, things that are not study related essentially. But like I was saying, when you get further up, for me, it was a little, especially when I saw the face, for me, it was a little, I don't know the word for it in all honesty, because we first had to do the chest. And then when we were doing the chest, we found like a really large thymus, which is a gland that's found down, like in your sternal area, which is supposed to sort of deteriorate with puberty and become smaller. And this guy's gland was pretty big. So which means that he was quite young when he died. And for me, I think what really sort of shook me was I was shocked that a child of that age would be in that, would be on like a cadaver table, even though from like a scientific or a medical point of view, it's not a big deal. You die, you die. But for me, I just couldn't imagine someone of that age sort of dying and then ending up on a cadaver table, because someone has to like sort of, donate the body, right? And I think you get paid for it, if I'm not wrong. So, to donate someone so young, because usually it's generally people who are old, like in practice in China, at least, because that's what the professor also said. She said, okay, this is quite unusual. And then when you come to the face of soon after doing the chest, that was a little difficult for me. I think that night I went home and cried, like for the first time ever. Because I was in my head, I tend to get a little, over analytical. I was like, what right do I have, or what's the reason behind me cutting him up and it not being vice versa? Like how does this sort of, how do things sort of play out in that context? That was one of my, like, what am I doing points.
That's a crazy story, like for me, and I guess for Duma as well, like looking at his face now. Yeah, that is like really fresh and like something like we haven't heard of. And to hear about that experience is like,
yeah, the thing is, like, because I barely hang out with people who are not in the medical scene, like it's interesting to know that it's so new, probably because we've again been so like it's been normalized, right, for us. So it's not that talk worthy almost. It's not topics that I sort of talk about with people I normally hang out with.
yeah, I mean, like you you don't want to like go home and talk about the same stuff again, right?
Yeah, but that was, I think, the first night I sort of probably cried in like due to a med related issue. I don't know, it was probably the first and maybe one of the few times. Yeah, definitely.
Jesus, yeah, even me listening to that story for the second time, because you've told me that story before. Dylan hasn't heard it, but you've told me that before, and I still have the same reaction. It's just crazy to me. Yeah, I don't know what to say. And I know you got another one in China, not human related, but yeah, pretty distressing, we'll say. If you wanna maybe touch on that.
Yeah. Oh, yeah. I mean, I'm all right with it. Yeah. So like China has this weird practice that I'm completely against, but they sort of force it on you, where they make you practice like sort of basic surgical procedures on dogs, and specifically beagles, right? And I actually researched into it, like, soon after that happened. And it turns out that even though like med students practicing on dogs is not normalized in, the rest of the world, but beagles are generally like lab dogs. They're considered, just sort of experimental dogs because they're so docile in nature. They're very soft, and they don't bite or they don't bark. They're just so trusting, which is, I think, the saddest part about the whole thing. And yeah, so I remember, man, it was really bad. That was actually the second time that I cried in like med school, and that was like in front of the professor too, and she was so mad because I could feel like the tears and snot just dripping down my mask because the dog was. I made eye contact with the dog, and the dog was crying, which is where I started crying. And yeah,
Jesus.
yeah,
Oh my God.
and there's almost no, I think, breathing room, because when I was getting all emotional, she got really pissed. I think, not she meaning like the professor. I think it's because like the way they function is they're quite stoic and rigid. I feel they're very hyper focused on almost the theoretical aspect of things. And I think that's also very easy for it to happen to you when you're in like the medical scene, especially if you're in a country like China, where use of animals in like lab work or even, experimental work is very normalized. Like, I'm not completely against the idea of using animals in any context. Okay, I think that would be, especially in the medical scene, I think it's I think it's hard to debate out and just completely say, no, you should not, especially if it's like life-altering drugs. But I'm definitely against the unnecessary use of animals. And what we had to do was definitely like 10 out of 10 unnecessary, like I would have walked out of there if I didn't worry about, sort of failing that subject. And then the next day I actually didn't turn up, but yeah, luckily she didn't fail me. I don't know.
Jeez,
But
man.
because of that experience, I'm like pretty sure I'm never gonna have a dog, just because that guilt sort of weighs in on me.
They know.
I'm just like,
yeah.
nah, man, like I don't deserve that.
Oh, wow. That's
Yeah.
Wow, that I can't like I don't think I yeah
Yeah.
like I'm kind of like lost for words, honestly.
Yeah.
Like listening to this for
I mean,
the
I don't
first
know what to
time.
say either.
so hang on. You said the dog was crying. Does that mean it was like aware? Like was it aware of its surroundings? Like, and you were performing live surgery on it?
It was under. I mean, it was. Yeah. No, I think he was terrified. Obviously, right? I mean, anyone would be in that setting. There's like a light over you, and people are sort of peering in, and they have all these scalpels and whatnots in their hands. But his face was sort of he did have a view on what was going on, but obviously he was scared. But I don't know the exact reason. We had sort of given him like an anesthetic, but I'm not sure if maybe the dose wasn't enough, right? Because I do remember he was supposed to be under throughout the entire procedure, but he sort of woke up in the middle, and we had to like re-inject him. Yeah, that was the time I started crying, because I sort of looked behind because I saw him moving, and then he was crying, and I was like, oh no.
Fuck.
Yeah.
Fuck. Okay.
I'm laughing now, but it's like a really bad coping mechanism.
I probably I don't know if I had to bleep everything. I just like went on a terrain of like swear words.
You did? I didn't hear anything.
Yeah,
Maybe you
'cause,
should
Nah,
maybe you should
leave it
edit
in,
this
leave it
entire
in.
story out.
No, man. I mean, like, I'm really thankful you're like sharing these stories. It's like crazy.
Maybe never like tag me,
They
because
get
I don't want to
cancelled.
get
You
know what I
can't
mean.
go back to China again.
I don't know what to say next in terms of like after hearing that. Like, it's almost like what I say next is like almost unworthy of listening to because of that story.
Do you want to like adopt a beagle? That would be a good topic.
I haven't like had my heart set out on that, but now I don't know.
It's like no, they have like entire websites on it. They have like beagle
Yeah.
sort of protection services and all that, where they save these dogs. And yeah, I think it's like I've seen like because I was so invested on this topic back then, I actually like searched for it and was just actively reading up on it. And I saw like even in the US, right, like some people had sort of sneaked in some cameras into some of these laboratories, and they had videoed. So it's like, yeah, so it's like it's not just a China thing, it does happen.
Yeah, that's been like a huge debate and like a huge topic for like a whole.
Yeah, I think what makes me mad is that it's the beagles, man. Like, why?
Yeah.
Why the beagle?
Even with stuff like cosmetics, right? Like, I don't know, makeup, shampoo, all that. They do that a lot as well. So
Yeah.
it's something to be aware of. Oof, okay, let's move on.
You mentioned a very interesting book a few days ago called On Death and Dying, right? It's kind of related to what we spoke about.
I mean, that's a very, it's a seminal piece of work in that field, I think. So that's Elizabeth Kubler-Ross. So she just had, she just went into a hospice and interviewed people that were, they were going to die, basically. And I
look at that book. Oh my God. He's like sticking out.
Notes
oh
everywhere
my goodness.
Yeah.
But
I don't even have a textbook that's that labeled and wow. Okay, I'm impressed.
I went a bit psycho with the sticky notes on that one, but it's good because she just interviews people, in the hospice, and it's different people in different stages of their sort of process, right, of dying, and I'm just interested to like hear about what you kind of had experience with. Like, did you work in sort of that kind of environment where people were dying, and have you had any close experiences with death in that sense?
For me personally, I think, again, like I said, I'm so early on in, in the medical field that I haven't experienced a lot of death, but I've seen, like, when I come in the morning, some of the patients were there sort of the day before, like the curtains are sort of covering their bed, and then I'm like, what happened? And then it turns out they passed away. So there's that. And I've sort of seen, like, one or two, I think, people dying and then CPR happening and all that. But for me, again, I was so hyper focused on what went down, because you've learned and sort of studied the theory in preparation for that moment for so long. And when you see it go down, you're just hyper focused on, hey, that's happening, and then this is happening, so that you're sort of extracting that information and storing it in for you to use it. And you're less focused on that person as a human. For me, I think the sort of the more stressful moments have been when you have patients who are going through like sort of really terrible, times. One patient, I think probably the patient that has stood out to me most, he was actually from Sri Lanka. He had a CKD stage 4, that's chronic kidney disease. It's like end stage, he had like end stage renal failure. And so he was in the hospital for about, I think, 2 to 3 months. So he had a lot of complications, a lot of infections going on in his chest, blood work, and even his urine. And he was, because, with kidney failure, there's so much fluid just sort of being retained in his body. So physically, he was in a very uncomfortable place. There was sort of fluid in his lungs, I remember. And then his abdomen was just so bloated, so much fluid. His lower limbs were also all swollen up. And because of the stasis happening in the lower limbs, there were like massive ulcers on his shin area. And I think the worst part was like he had massive scrotal edema as well. So we had to sort of sling the scrotum for support through like, quite multiple instances. And he was obviously catheterized. So moving around for him was very difficult. Just to use the washroom, once or twice a day, maybe. But obviously, when you see the patient, you can see how much discomfort he is in. He can't even lie down because it's difficult for him to breathe. So he has to sort of stay propped up. And he's been in there for so long that his family, obviously, like in Sri Lanka especially, you have to work. You need to make money. So his family has, for 2 to 3 months, right? They've been too busy to sort of be there and be present. And he was with a caregiver who sort of come, like they're obviously stationed there permanently, but different caretakers, like maybe every few weeks. Not caretakers, my bad, sorry, caregivers. And I remember there were like, especially towards the end of like when right before he was discharged, I think, and that too, he just sort of forced, a discharge. Towards the end, this was close to, I think, New Year's. That's not December 31st, the Sri Lankan, the Sinhala Tamil New Year in April. So he kept sort of asking to go home. He was like, I really need to go home, because his room is like, it's like tiny, and he had a window that sort of looked out to the hospital. So you can't even see the sun, nothing of that sort. And so he'd been mentioning this to me a few days, for like a few days repeatedly. He was too scared, I think, to ask the head consultant who makes those decisions straight away. Because again, I was like, I'm like so new to it, right? I'm not burnt out yet. So I was able, like, typically I'm like one of the few people there who actually put in a little bit of effort to sort of even interact with these patients. And a lot of the nursing staff and a lot of the doctors, they're like completely burnt out. And I think so he was trying to sort of get to the consultant through me, because he was like just intimidated to approach the consultant straight away, because that's like such a Sri Lankan thing. And and I remember like I asked the consultant, and he said, if this was in front of the patient, and he said, like, if I do discharge him now, he's going to have to come back in like, 1 to 2 days, because some complication is going to sort of pop up. And I remember this guy just saying, like, please let me go home. I just want to like go to my garden and just sort of look at the sun and my mango tree. That's what he said, like the sun, not his son, but the sun. And it was like such a simple request, but that sort of really resonated with me, because, that's all that guy sort of wanted to do. And at that point, I felt like we were just keeping him to almost, just for the sake of keeping him. Like his family wanted to prolong his life for as long as they could, and just to keep them happy. And also, I think from like a doctor's point of view, they want to keep the patient, stable for as long as they can. And yeah, so sometimes I sort of think about, like for me, I was like, man, like, you should really just let this guy go home, like what's the point in just keeping him in this, dark room for like more months to come? That was like sort of going through my head. And I thought like, maybe if I had this choice, I would probably just, take the easy way out and go home.
Yeah, and that perfectly aligns with what actually what's in the book, right, on death and dying, because she kind of relates the story that she experiences as a kid, where in a village she saw this old man die, and he just died at home with his family present, right? And he got everyone in the village to come over. They talked about stuff, did all the final, took care of all the final details, and then slowly passed away. And he wasn't rushed off, right? What she's kind of saying is, what kind of happens nowadays, as soon as something serious happens, you put into an ambulance, rushed off, no one is around you. It's a totally new environment, very clinical, and obviously it doesn't mean we shouldn't save people and we shouldn't try. We should stop trying, but I think more sort of thought needs to be given to sort of quality of life as well. Like, what's the point of prolonging life if the quality is like minimal?
Yeah, I think that just sort of comes up from the fact that when someone dies, there are two groups of people who sort of go through it. Firstly, it's the person who dies itself, and secondly, it's his family and loved ones, right? So I feel like towards the end, for so long, we've been almost giving priority to those around him, because that's what they'd want, right? They'd want to sort of spend as much time as you can with the patient. But I think there are certain situations where you should think about what the patient wants, and there are I think quite a few situations where the patient himself is like, he wants to sort of opt out, but when he does sort of tap out, he's going to become somewhat of a burden on his family and all that, right? So he wants to also leave, metaphorically, with a minimal burden. And so there's a lot of things that sort of weigh in. So it's very difficult to, come to a just make a conclusive statement saying, you need to discharge him or you should not. But yeah, it's definitely things that you should take into consideration outside of just keeping a patient alive. Like why, for what reason?
And you said there's two groups of people, right? I would say there's a third group, right, which is the medical practitioners. Do you guys feel like, we could have done better, or we could have done it this way and we could have saved him? Or was there none of that going through your head?
The thing is, I don't think I'm qualified to sort of make a statement on that, just because I'm not there yet, right? But from a doctor's point of view, I think there are probably a few cases, from people that I've spoken to, there are probably a few cases that stand out to them, if it's, let's say, their first ever case, or if it's a patient who's like really young, things that sort of make individual cases stand out. But outside of that, I think on a day-to-day basis, it's so part of their normal routine that it doesn't really register, probably.
Interesting. So what happened to the guy in the end? Do you know?
The thing was, I took leave for like a week, and when I came back, he was gone. But I'm assuming that he sort of requested a discharge. He said, like maybe sort of forced the discharge and left, or he transferred hospitals, one of the two. And it's difficult to sort of keep in touch, because the Sri Lankan system, like I said, isn't electronic. So you don't get like electronic health records where you can just type in and check what happened, right? A lot of the records are sort of filed away, or he takes it with him to whatever hospital he's going off to. So yeah, it's one of the downsides of the healthcare systems here.
Does that kind of, like, when you meet a patient, do you try hard to not make an emotional bond with them, like try not to relate with them, so that if something does happen, it has a less of an impact on you, or you don't think about that? Or
I think initially, I was like, when you're so young and fresh to the field, you're so eager and, you want to do your best. But towards, after I think for even just a month, I was just done. Like, I remember there was this one guy who came in who was transferred from like the surgical department, and he was on antidepressants, and they took him off like some of his psych medication because he has PTSD. He was a soldier, and he said that he was kidnapped with he was not kidnapped, like taken hostage, him and a few of his comrades. And he said he went through some really shitty stuff, and he obviously wanted to talk about it, but I was just so done at that point. I was like, I'm gonna get a house officer or someone from the surgical department, and I just left because I was so emotionally drained at that point, and he was obviously being looked after by the psych department as well. I didn't want to bite off more than I could chew, and also you just try to stick to your bare sort of requirements when it comes to things like that, because there's a lot of stories that you can sit down and listen to, and I mean, I feel like Duminder would probably be up for that. He'd be like, yeah, sure, I'll do it all day. But yeah, I was just done. There have been a few instances like that, yeah. Because if you, I think, try to connect it, yeah, I think you'd probably like it. Probably make a podcast out of every conversation.
I do work in a hospice, like a children's hospice at the moment, as a volunteer. So that's been super interesting as well.
Oh, right.
Yeah, but obviously, yeah, like you said, I mean, my role there is to actually connect with the kids and, make that end of life period more enjoyable for them. But whereas your sort of...
Is it palliative care? Is it like a palliative center?
It's more of a hospice than a palliative care.
Okay.
But I feel like your sort of environment is a bit more, I don't know, like emotionally dangerous, right? If you're playing with fires, you want to, you don't want to like get too close and kind of burn yourself, I feel like. But if you're going back to sort of your experience with the medical field, I know you worked with a lot of, like you said, like military people and all that. So does that kind of put your day-to-day sort of stuff into perspective? Like if you're going through a hard day with, I don't know, something, you're like, kind of, you have that perspective to put onto it, or not really?
I think it just made me, I think probably one of the most significant things it sort of made me realize was that how privileged we are, because growing up, like even you guys, I'm sure at certain points you probably feel like life is really unfair, and there are certain situations where it's not just, and you're like, this is not right. But then when I sort of was exposed to people who went through things like that, I realized just how lucky, blessed, privileged, whatever you want to call it, we were. Because like some people that they were in like their 40s or 50s, but then you realize that they spent like the entire youth, the best years of their life, sort of doing all that, right? And when you spend the best years of your life sort of doing that, it's very difficult to move on from that. It's not like even me just going through med school, it's not like that, right? You go through and you experience some like really crazy stuff that's going to change the way that you see life indefinitely. And I don't think psychological therapy or whatever was provided to these people in that sense, and they were just sort of thrown back into reality, and they had to learn to sort of navigate that. So a lot of the people that I did speak to, I think I felt I don't know what I felt. It was quite depressing in the sense that you'd hope that these people would be living better lives, but that's just not the case, and so like the reason why we were sort of so sheltered and privileged was very largely attributed to these people as well, right? And we're just so blissfully unaware of a lot of the things that they had to go through.
Yeah, definitely, like the effect it had on the people involved, I guess. That true to a sense, that is true to a sense where like we don't really know what happened, and like you said, we don't know what these guys went through. Like we see like people dying and people like we see the dead, and like all due respect to them as well, but we don't think too much about the people who actually went through with that and like are living now dealing with that, and like that is an important conversation.
Yeah.
Yeah.
And now I think, Vinay, you're right in saying that we need to be aware of the fact that we were sheltered, and the fact that we were privileged and we are privileged and blessed is because of other people who sacrificed their privilege, right? We're standing on, shoulders of giants, like they say. And that's a good point to keep in mind, I think, for everyone.
Okay, I think we've definitely covered like a whole bunch of stuff, and we should move on to finish off the podcast, I guess.
Yeah, we should maybe wrap it up, I think.
Yeah. Vinna, thanks for coming in.
Thanks for having me.
Yeah.
It was nice chatting. Felt like
Yeah.
catching up with old friends, right? But talking about more
Yeah, it is. It is.
serious issues, I'd say.
Yeah,
Definitely more
yeah.
serious than what we used to talk about in 11th grade, whatever that was.
Wow.
Yeah. All right. To wrap it up, I guess, thanks for listening, everyone. The Dumba's still laughing. I'm not sure if it's the lag or if he's like